Hello everyone and welcome to our video on the basics of pediatric medication calculation. So what makes MedCalc different in pediatrics than it is in adults? Well, most of our doses are weight-based, so you'll need to be able to convert pounds into kilograms. And if you recall, 1 kilogram equals 2.2 pounds. We'll do a practice question here in a moment with this. Many medications are oral liquids or suspensions, and each one of these has their own concentration. For an example, you might have a medication that has 250 milligrams in 5 mLs. You'll need to be able to figure out how many mLs you'll want to administer. So using that example, if you were to give 250 milligrams, you would give all 5 mLs. If you only wanted to give 200 milligrams, that would be 4 mLs. We take the same approach to calculating IV fluids and IV medications. Most of these are weight-based. We're going to practice with maintenance fluid calculations a little later in the video. For IV drugs, each one of them has a concentration as well, such as in this example, 2 milligrams in every 1 ml. You'll need to be able to figure out how many mLs to administer. Using this example, if you wanted to give 2 milligrams, you would give the entire ml. But if you only wanted to give 1 milligram, you would only give half of the ml. If you have to run these fluids or medications over a period of time, you have to use an IV pump, and you'll need to be able to figure out the rate for the IV pump. For an example, here, we have 300 mLs over an hour would be 300 mLs an hour. But to give that same 300 mLs in half an hour, we would need to set the pump at 600 mLs an hour.
So let's go through some examples. The first example, we'll take 44 pounds and convert it into kilograms. In order to do so, we would take our 44, using our formula from before. We want to divide that by 2.2, and what you get is a nice and easy rounded 20 kilograms. So here's an example of a question that you might see on a pediatric medication calculation test. This question reads that the physician orders Tylenol, 320 milligrams, to be given every 4 hours. You look up in the drug book and you see that the appropriate dose of Tylenol is 10 to 15 milligrams per kilogram per dose, and the patient weighs 21.5 kilograms. So how are we going to figure this out? We're going to start by figuring out the appropriate range. Now we know from the drug book that the range is 10 to 15 milligrams per kilogram per dose. And we can see here that we have the kilograms right there. So to do our range, we want to find out what's 10 milligrams per kilogram and what is 15 milligrams per kilogram. In order to do that, we times each of these by 21.5, which is the patient's weight. And you get 215 milligrams down here, because remember, these kilograms cancel each other out. And then same over here, you'll get 322.5 milligrams. This right here would be the range of a safe dose of Tylenol for a patient who weighs 21.5 kilograms. And now that we have our range, we can see that 320 milligrams sits very nicely right inside this range. So is it a safe dose? The answer is yes. And now for the second part of the question. Now we figured out 320 milligrams is a safe dose and well within this range. But now we need to figure out how many mLs to administer. So how are we going to go about that? Well, we know our dose, this is what we want to give, and we know the concentration. Well, there's a few different ways to do this. You can do desired over half, which is probably the most common way. To do this, we would say that we desire to give 320 milligrams. And what we have on hand is 160 milligrams. and you times this by the quantity, which in this case is 5 mLs. To do this, we take 320 here, divided by 160, times 5. And this gives us 10 mLs. So let's work through one more example. In this example, the physician orders ibuprofen, 150 milligrams, to be given every 6 hours. The dose of ibuprofen is 10 milligrams per kilogram per dose. In this case, the patient weighs 15 kilograms, and our concentration of ibuprofen is 100 milligrams per 5 mLs. So is the dose safe? Well, in this case, we don't need to figure out a range because we're given a specific dose. And all we need to know is does this dose match the dose in the drug book? In order to do that, we know that it's 10 milligrams per kilogram, or in this case, 15 kilograms per dose. And that gives us 150 milligrams, which is exactly what we have here. Now that we've figured out that yes, our dose is safe, we need to figure out how many mLs to administer. Well, in this case, we know that we have 150 milligrams that we want to give. On hand, we have 100 milligrams, and our quantity is 5. So to figure this out, you could take 150 divided by 100 times 5, which gives you 7.5 mLs. Let's move on to calculating maintenance IV fluids. To calculate your daily maintenance IV fluids, for the first 10 kilograms, it's 100 mLs per kilogram. For the second 10 kilograms, it's 50 mLs per kilogram. And for anything above that, it's 20 mLs per kilogram. So let's do an example. Let's say your patient is 15 kilograms. For the first 10 kilograms, we're going to do 100 mLs per kilo, which comes out to 1,000 mLs. Now we just used the first 10 kilograms. So what do we have left? 5. Since we only have 5 left, in the second category here, we're going to take 5 kilograms times 50 mLs per kilogram, which gives us 250 mLs. We add those up, and you know that your patient, who weighs 15 kilograms, has a daily fluid requirement of 1,250 mLs. To figure out the hourly rate, you would take our daily requirement, 1,250 mLs, and divide it by 24 hours. This gives us 50 mLs per hour. This is what you would put on the IV pump. Now for our final example, let's do an IV medication. Using this example, our order reads we're giving Ceftriaxone 600 milligrams IV daily. Our instructions are to infuse it over 30 minutes. The appropriate dose from the drug book is 50 milligrams per kilogram per day of Ceftriaxone. This patient weighs 12 kilograms, and the concentration is 1,000 milligrams in every 100 mLs. So let's start with, is the dose safe? In order to figure that out, we need to know what the dose is from the drug book, and we need to know our patient's weight. So if we take our 50 milligrams per kilogram times 12 kilograms for the patient's weight, we do get 600 milligrams, which matches our order. So is the dose safe? The answer is yes. Now we need to figure out how many mLs will we administer. Well, we know from up here we need 600 milligrams, and we know our concentration is 1,000 milligrams per 100 mLs. So our desired is 600 divided by what we have is 1,000 times 100, our quantity. So what we end up with is 60 mLs. So for the last part of the question, we need to figure out what is the appropriate rate. Well, we know already that we have 60 mLs that we need to give over 30 minutes. If you look at a clock, how many 30-minute segments are there? There's 2. So we would take our 30 minutes and say that there's 2 of those in an hour. So if we took our 60 mLs times 2, you get 120 mLs per hour. Let me do that one more time, but let's say we wanted to infuse it over 15 minutes. We would take our same 60 mLs that we want to give. Going back to your clock, how many 15-minute segments are there in an hour? There's 1, 2, 3, 4. So to figure out the hourly rate for a medication over 15 minutes, we would take our 60 mLs times those 4, and we would be setting the pump at 240 mLs per hour.